Contrast-enhanced imaging is a critical diagnostic tool, but supervision has always been a logistical challenge. But what if on-site presence was no longer a barrier? A significant CMS policy update has made that a reality. And this isn't temporary. CMS has proposed making this virtual supervision permanent, signaling a fundamental shift. This evolution directly confronts radiologist shortages, staffing bottlenecks, and the struggle to maintain care standards. So, how can you integrate remote supervision? We'll break down the technology, benefits, safety, and compliance path. First, what is remote contrast supervision? It connects technologists with radiologists via a secure link for expert oversight. This isn't theoretical. Hospitals are adopting this model now to increase efficiency and reduce staff strain. The primary driver is the radiologist shortage, creating coverage gaps. Remote systems let one doctor cover multiple sites. The entire system hinges on one vital component: real-time, two-way audio and video, making the physician virtually present. When integrated correctly, this model delivers a powerful combination of improvements: operational efficiency, patient access, and safety. Let's focus on safety. The goal is to mirror the safety level of a physician in the room, requiring instant communication. In an emergency, like an adverse reaction, the remote physician must instantly guide the on-site team through established protocols. This works because CMS defines direct supervision to include this interactive link. The key is immediate availability. Consider a health system with multiple imaging centers. One physician can now virtually supervise contrast studies at all of them. This dramatically improves access, especially in rural communities. Patients no longer face long waits or travel for a specialist. Facilities can easily extend operating hours into evenings and weekends without complex on-site physician scheduling. This model is effective now, but what does the future hold? How is the ACR preparing for this to be the new standard post-2025? The financial case is just as strong. It directly reduces costs by minimizing idle staff and operational overhead. Ultimately, it's about optimizing your radiologist's time. Better allocation means less burnout and a more resilient staffing model. So, is integrating this as simple as turning on a webcam? Successful implementation requires careful planning. First, federal approval doesn't override state laws or hospital bylaws. You must align with your own state and facility policies. Second, the technology cannot fail. The system must be dependable, secure, and have redundancies for a stable connection. Third, your on-site team needs specific training on the platform and must be drilled on remote emergency escalation procedures. Let's connect the dots. The CMS rule change we opened with directly enables the cost reductions and efficiency gains we just saw. And multi-site coverage isn't just an operational perk. It's the mechanism that breaks down geographic barriers for rural patients. Earlier, we asked about the future. The ACR is already providing the answer with detailed specifications for 2026 and beyond. This shows that achieving full compliance with CMS, ACR, and HIPAA is what unlocks these measurable operational results. Remote contrast supervision, backed by regulatory changes and solid technology, is a practical solution for today's imaging challenges. It improves efficiency by optimizing radiologist time, expands access for all patients, and maintains the highest standards of safety. Integrating this model is a strategic decision that positions your facility to be more agile, cost-effective, and patient-centric. With CMS proposing permanence and the ACR building the framework for the future, the direction for modern radiology is clear. The time to act is now. Evaluate your current staffing models and identify supervision bottlenecks to find your biggest opportunities. Look into the available technology platforms that are compliant and built for this purpose. Then chart your path to implementation. By adopting this change, you ensure that every patient, regardless of location, has access to the imaging they need, safely and without delay. Learn more about building your remote supervision program.